The question is that this bill now be read a second time, and I call the member for Warringah.
Thank you, Madam Deputy Speaker. I rise to speak on the Midwife Professional Indemnity Commonwealth Contribution Scheme Amendment Bill 2024. Sounds technical, but it is incredibly important to women in their birthing choices. Equitable access to midwifery services is an important step in ensuring Australia's maternal health care system meets the needs of expectant new mothers. This bill represents an important step forward, addressing critical gaps in care and providing necessary support to the vital work of midwives who are essential to achieving better outcomes for both mothers and babies. The current scheme provides indemnity coverage for antenatal and postnatal care but excludes intrapartum services provided by privately practising midwives outside of hospital settings. This bill closes that gap, ensuring that government will cover 100% of eligible claims for these services, no matter where the birth takes place. This change is a win for midwives and mothers alike, enhancing the safety and accessibility of birthing options across the country. I commend the Minister for her commitment to improving maternal care and listening to community concerns. The decision to remove the term low risk from this legislation is particularly significant. It ensures that all women, regardless of how their pregnancy or birth is classified, have access to the support they need. This change promotes equity, providing women with greater autonomy and choice in how and where they give birth, as well as recognising the role of midwifery care in all aspects of maternal health. Midwives play an invaluable role in supporting women throughout their pregnancy, childbirth and postpartum period. In fact, research from the Australian College of Midwives consistently shows that continuity of care with a known midwife improves the outcomes for mothers and babies, including reducing the need for then medical interventions. Midwives not only ensure safe and positive birthing experiences, but also provide vital postnatal care, including screenings for mental health concerns and domestic violence. They have that access to new mothers, and they are able to get to discuss any ongoing concerns and identify problems. Tragically, and it's quite an incredible statistic, suicide remains one of the leading causes of death of postnatal mothers, so it just makes that ability for midwives to do that continuity of care postpartum so incredibly important. So these services are critical for the well-being of new mothers. It puts midwives in that position and ability to identify and to discuss if there are concerns from a domestic violence point of view. We know statistically this is the time where women are often most at risk because that's been such a change to the relationship. And so it is vital for mothers to have access to that care. I also very much want to thank the Minister for her engagement on the issue. Earlier this year, Minister Carney visited Warringah to announce additional funding to support midwives in providing longer postnatal consultations. Again, that is really important because that longer consultation allows for that discussion and that addressing or identifying all of those risk factors around domestic violence or mental health of mothers. Those consultations allow time for comprehensive birth debriefings, mental health screenings, and these are so essential for early intervention. These were key changes that I'd advocated for, like many others, alongside the Australian College of Midwives, who have worked tirelessly to bring about these changes, and I commend them for their hard work. And this bill presents the next step in improving accessibility to midwives for young mothers. As we move forward, we must remain focused on addressing broader systemic challenges, though, particularly improving health outcomes for First Nations women. We know, unfortunately, the statistics are not good, and it is not an equitable access to healthcare. This bill will help provide greater access to birthing on country programs, which assist Aboriginal and Torres Strait Islander women to give birth in a more culturally safe way, surrounded by family and community. The research indicates that this is important. Birthing on country provides better mental health outcomes, strong connection to cultural heritage, and improved physical outcomes from mothers and babies. And again, those longer consultation times mean all those screening factors can be present all the more. In fact, Charles Darwin University's Indigenous Birthing in an Urban Setting study to help close the gap in Brisbane found that birthing on country reduced First Nation preterm birth from 14.3% to 8.9%. So that is a significant improvement. So it shows the importance of creating and maintaining a maternal care system where women have greater choice, respect and support. Women must be at the centre of the system, and the absolute priority being greater options and choices in where birth can take place and how it can take place, and especially that it be culturally appropriate. So this bill brings us closer to achieving that vision. I commend the Minister for her leadership in this area.